Okay. Yeah, thank you very much. The Wi-Fi is very dodgy this morning. It's already coming in and out here as well. So some of you might want to turn your cameras off to protect your Wi-Fi. Of course, you'll have lots of other people in your households, no doubt, that are streaming and using the Wi-Fi as well. So it is going to be a bit of a struggle this morning. So I'm going to start off then just by asking Nick, if you would like to start, please, by giving a brief overview on the topic around mental health and well-being. Over to you, Nick.
Happy to do so. Before we start, two things that inform everything that I say. The first one is I'm an official. I'm a relatively new official at the NUJ for about 2 years. Before that, I was 20 years of freelance, which also feeds very much into sort of my understanding of where our members at. And because our members fall outside of, for the most part, fall outside the chapel structures, a lot of them can sort of be forgotten about, although they are a sort of a third of the union. So that's two things I am. Two things I'm not. I'm not a mental health expert, although I have had some training. I'm not as good on health and safety as other people on this call, although like all officials, we're across all of that. So what I'm about to speak on draws from my own experience. It also draws from my own experience as an official. There are two maxims as well I would start from, that our members tend not to seek help when things are going really good. They tend to get in touch with an official or a regional office or a rep when things are starting to go a bit pear-shaped for whatever reason. And also when things are really falling apart for them. Again, that is the point where we can sometimes struggle to get in touch with them. I was reminded while putting together my notes this morning that actually a few weeks ago I'd reached out to a member of mine who I've helped in the past, and I dropped him a courtesy email and said, you know, how are things? How are you holding up? How are that? And while putting this together and a few points, it completely, I realized I hadn't put down a follow-up on that. I hadn't heard from him. And again, this is the kind of problem, because that's a difficult conversation for anyone to have. A good starting point is that everyone is going through a huge amount of mental stress at the moment for various reasons, with their the fact that they're disconnected from the workplace, disconnected from the normal chapel structure, disconnected from the fact of they're unable to look up from a desk and see a union official or sort of a workplace rep, is going to cause significant issues, from being at home, being in some cases unable to escape from work because there isn't a separate room you can close a door on, and from simply being, with your family for a huge amount of time. My family would be the first to tell you that, that would cause them considerable stress as well. So of all of the things that a good starting point is not, is there something, what are the issue with the member, but what is this and how is the member coping with that, and how can we support that? We've had the one thing I found within the Scottish office, we put out a sort of periodic email raising issues from that. The one thing I noticed was, as soon as we started going to lockdown, when we've started putting these out, I've had responses back that just say nothing other than, thank you for getting in touch. I really appreciate you getting in touch. Now, this may reflect that perhaps freelancers have more time at the moment, but I think it does actually reflect that any kind of contact made by the union, asking the question, getting in touch with a member, addressing them as a member is an extremely positive first step. It's when members start that conversation with me, or more particularly when members ask the question, how are you doing? That's a sort of sign for me that I should be asking that question back. People become more aware of their own, of the effect it may be having on others when they understand the pressures that they are under themselves. Within the workplace, we've talked about the disconnection from work, the problem that we have. I've dealt with members who quite simply the problem has sometimes boiled down to their manager has not spoken to them within a couple of weeks. I mean, that's a very, very simple thing, but at a time like this, it's particularly critical. It's easy to be overlooked by a manager. but the actual effect and importance of that on a member at any time is crucial, particularly those who have been put on furlough. Those who have been put on furlough, if companies are continuing furlough, it's going to be the ones that have been furloughed already that will have to be furloughed because they can't bring anyone new into the scheme. And the fact that furlough is essentially saying the company can manage without you in the short term always begs the question of whether the company can manage it in the long term. So all of the long-term planning that we would normally have in our personal lives and our work lives has kind of gone out the window. So all the sort of routines that I can see for myself, like at the end of this week, I would have been going on summer leave and you know, leaving the country. That's not going to happen. I don't know when it's going to happen. I don't know when the next milestone like that is. There is at the moment not particularly an end in sight for when things might return to normal or what normal might be when we return to it. And the inability of something to look forward to there is going to have a really detrimental effect. So industrially, we need to be pushing for managers to support. The mental health support within organizations varies significantly in my experience. The first step is usually crap. I've had a member who has gone and, you know, he's been given a number of something to do, you know, a number to phone, which he doesn't want to do. Now, I've encountered this within the NHS in Scotland with mental health, where the first thing that they do is give you a CD, which is an interesting development. I don't think anyone has a CD player anymore to start off with. But it's a kind of triage. It's a test. And you have to, when members are first on that, it's to encourage them and support them. For those who have sought mental health support from their employer, the first step will be a crap step, but they're testing the member. The company's testing what's the least they can get away with, and the members being tested, you know, how is this? A lot of members give up at that point, which companies in some cases consider a success. It's the idea of getting on with the member and supporting them and saying, right, we need to go back and say, we've tried this and it hasn't worked. How do we escalate it? What is the next thing? When that step doesn't work, you can sometimes get onto the actual, you know, the actual quality schemes that can support our members. So yes, going back through that, there's we've touched on it before at previous meetings, and a lot of the issues that we've talked about have overlapped. But simply the working environment of how people are at home, which the companies do have a health and safety responsibility for, has a direct effect on mental health, on security, on, you know, how people feel about their job. So literally sitting on an uncomfortable chair or a desk that's the wrong height, or in one case with one member I'm dealing with, sitting on the edge of a bed and using a bedside table as a desk during the day and spending the day there and then having to return to that room to sleep in the evening. All of this is not conducive at all to any kind of good mental health. So the outside factors that impact on that are crucial as well. That's been exceptionally disjointed. It does reflect my own experience, and I'm sorry there wasn't a clear narrative through it, but I hope it's given enough for other officials to pick up on.
Thank you, Nick. That was really useful, and I think it helps us to give a bit of a framework for what we're talking about this morning, which is that the issues are varied and that there are some common threads that run through mental health and the experiences that different people are having, but also it does highlight the fact that individuals are experiencing this crisis many different ways, and actually their needs are quite different as well. So how we respond to that, we need to be thinking about, you know, what are those specific needs and how we can help that member address those specific needs. And again, that doesn't mean to say that we have to be specialists. And I think the point that Nick made at the beginning is, I'm not a trained counsellor, I'm not a mental health specialist, but there are things that we can do to help members, to signpost members. And there's lots of information that the NUJ has put together. So the Equality Council has put some information together. I'm going to put some links up on the chat for you to take you through to some of the information that's been put together by the NUJ. And also there are some links at the Equality Council and the NUJ under the mental Mental Health Awareness Week, there was some work done. So I'm going to put some of those links up. And if anybody else has got any links that they want to share as well, then please do put them up on chat, because this is about how we can support members in the way that they need, and we need a variety of different tools to be able to do that. And the other point I wanted to just pick up on, Nick, there, which was really important, is about that initial contact with members and the importance of union, of the NUJ having contact with a member, reaching out to members, making that initial contact. I've been working with some members this week from a different union, and one of the things that really struck me, even after all these months that we've been living like this, is there were some members that were saying, this is the first time that I've had any contact with anybody in 3 months. This is the first time I've had any contact. And they found it very emotional, and it raised a lot of issues for them that they'd been suppressing in order to be able to deal with the stuff that was going on for them. So, you know, reaching out, the union reaching out to members, I think is really important. We can't assume that members are going to come to us and tell us that they've got issues, they've got problems. Actually, we need to go out to them, and we need to ask them how they are, and we need to offer that opportunity in whatever way we want to do that, through having virtual branch meetings or chapel meetings, to provide a forum for members to be able to actually communicate with us. So thank you, Nick. I think there's some really important points made there. Would anybody else like to come in before I ask the next official to come in? Anne, would you like to unmute yourself and say what you'd like to say?
This is just brief now. I'm chair of the Disabled Members Council, and I live with ongoing mental distress, and I'm the lead on TUC Disabled Workers Committee on mental distress. So I'm talking both from people new to members who are going new into distress, and members with existing and ongoing conditions. They're equally possibly we need to be aware of. For members who sorry, I actually wrote a note for you. For members who are already living with mental distress, the lockdown is almost certainly going to have limited their ability to access support networks, treatment, and their usual means of managing their mental health. Additionally, some members may be experiencing post-traumatic stress in relation to covering COVID-19. Photojournalists seeing a COVID ward. I know that's been an issue in the Photographers Council. It's crucial that employers take these issues seriously and take proactive measures to support and protect the health and safety of workers, whether remotely or in the workplace. And we've also got a real issue with about a third of our membership being freelance, so they won't actually have someone to turn to. But workers who have employers, there is still a huge stigma around self-disclosing mental distress. Mental distress is the way that long-term survivors of mental ill health or mental distress prefer to use the terminology as a wider. It's rather than mental health, mental ill health. It's fine to talk about mental health in the union, but if you were engaging with experts with lived experience, generally can you use mental distress, because it will get us going on to the social model of mental distress, which is just as important as the social model of disability in anything. Unfortunately, any legislation that we can use to support members is medical model. The Equality Act 2010 is social model for all the other protected characteristics, but uses very medical language for who is protected on disability grounds. And disability is a huge area. Many members may not consider themselves to have impairments, but if you're in remission from cancer, you are covered under the Equality Act, for example. Okay, so one thing to...
Sorry, Anne, do you want to make... Sorry, can I ask you to make a final point? Thank you.
One thing that is really important, though, for reps, we need to learn to safeguard our own mental health in order to be able to support members in mental distress. and this is your number one. It's like the, you know, you've got to put the mask on yourself before your child if you're in the cabin, sort of thing. It's number one, please, because you can end up doing more harm than good, both to yourself and to the member. Thank you.
And that was really important. You made some really important points there. Thank you so much. And I will pick up on some of those. And I am going to put some of the information you put on there on chat, particularly around the distinction between the medical and the social model of mental health, mental distress, which is hugely problematic because lots of employers rely on the medical model. They don't look at the social model. And for those of you that don't understand the differences between them, I will put some links on there giving some definitions, because I think it's really important that we understand those distinctions as reps so that we can support members challenging employers when they look at the very narrow medical definition of what constitutes mental health, mental distress, etc. So thank you, Anne. That was really important point to make. So again, as I say, I'll follow up on that. Is there anybody else who'd like to add to that? Nick, would you like to share what you'd like to say?
Hi, yeah, it's just picking up on something that Nick was talking about, the issue of kit, chairs, speakers, monitors, that sort of thing. I've sent around a survey at here in BBC Wales using Google Forms of all things, which is a way of getting kind of a real life feedback. So you include a link in an email that you send around saying, there's this little survey here. If you've got an issue, if you think you'd benefit from having I think it was a monitor, a keyboard, set of speakers, a chair, that sort of thing, click it and you get the figures coming back. That's been very useful because they weren't initially sort of persuaded of the idea of lending out a lot of kit which is not being used. Now they've adopted the idea and are drawing up their own plans to issue kit. So this is going to be very useful to be able to slip in some figures to show that there is an issue. It's not a big issue, it's a small issue, but it's an issue that we're now on. And also the email went to all news, not just members, to every member, so non-members as well. So I thought that was a way of flagging up to other people that the union is around and is doing things and is seen to be doing things. And I've had emails back from people who are non-members, so I can include those in the figures.
Thank you, Nick. That was really useful to hear that. And I wonder if you wouldn't mind sharing that link, the Google Forms link maybe in chat, which would be useful for people that aren't aware of it. I think that's really useful because it is all about evidence. It is all about providing evidence to an employer of what they should be doing and just reminding them of what their responsibilities are, particularly around home working. What are their responsibilities to provide equipment and a safe environment and a way of doing it? But it's also could be really useful for freelancers to understand what they can do and how they can put things into place to help and make sure that they're putting things into place to protect their health over this long-term period of being isolated, potentially being isolated and spending huge amounts of time at home. So thank you, Nick. That was really useful.
Sure, I'll send you the link and you can explore it and then and send it around.
Yeah, I think that's really important. I've heard a lot of people talking about surveys. Surveys are really important at the moment because they provide lots of evidence and lots of useful information. Would anybody else?
Well, Nick said, you know, because there's no workplace rep, so people can't literally walk around the newsroom and ask people and do a checkup, you know, survey in person.
Yeah, and of course the NUJ can help with surveys as well if anybody wants surveys, because the NUJ can help set up through SurveyMonkey. We can set up SurveyMonkey surveys for you. So there's plenty of support and help for you. But that's brilliant. I've not come across that Google Forms survey, so that's really helpful, Nick. Thank you. Anne, did you want to come back on that point? And then I'll come to
no, it's okay, but I know, well, I will just say one thing that I know probably for our union with our types of working may sound a bit strange, but digital exclusion is actually causing great mental distress even amongst some of our members. We've got 2 members on the Disabled Members Council who cannot access through various reasons. They have barriers to accessing emails. The only way to communicate is by phone, and we have to remember that for some some members. I mean, I know our union, you would think that we were all techie, but we've also all had to go on a self-driven learning course how to use these new platforms if we weren't using them through our work already. So, and I think Jenny Sims in 60 Plus is doing really good work on this.
Thanks, Anne. That's a really important point, because we are experiencing that. Many members are feeling excluded because they haven't got access to the tech. Never mind about being able to understand a lot of the new technologies that are coming in. I think it's a really important point, to think about different ways to be able to access members, to ensure that we're not just using one platform, because that can be excluding. The other point I just want to make, I talked about NUJ information. The NUJ has got, we've got wealth information, and again, I'll put the passwords and the links in here to lots of health and safety documents that have been written by the Health and Safety Committee. And there is a checklist specifically looking at the setup of how you set your workstations up at home. And there's a checklist there to help you go through to make sure that you get the right outcomes and the safest outcomes. So I will put that on there. I'm going to go to Adam first because he had his hand up, and then David, I'll come to you afterwards, if that's okay. So Adam, do you want to go?
I was just going to make exactly that point, Caroline, that we've got that note with a checklist. For doing inspections, the health and safety regulations are all based around doing inspections in person. There's actually nothing there that says you can't do inspections remotely. One of the things that we've included, which was a suggestion that came to us, was if people have somebody else in the house, is to get them to take a photograph of the person, the NUJ member, at the normal workstation, sitting how they normally sit to work, and then sending that picture for those of us who are digitally included to a rep for them to have a look at. So you can see whether the posture's okay, whether the screen's okay, whether the lighting's okay, and then if necessary, that photograph can be passed on to management with a list of that's wrong, that's wrong, that's wrong, that's wrong, to try and get something sorted. It's under the display equipment regulations is where it is. If you want to go and have a look at those, there are, there's a lot. It's actually one of the better sections of the Health and Safety Executive, the HSE website, which is now part of .gov.uk. Caroline's just sent that round in the chat, I see. Highly recommended. If somebody's on their own, even if they can't be in the picture, and there's a exceedingly well-placed mirror, I suspect, or they can do a selfie at arm's length. A photograph of the workstation. Nick mentioned somebody sitting on a bed with a bedside table. Clearly that is in complete and utter breach of the DSE regs. So get the members' permission and take it up with management and point out that it's in breach of the DSE regs. Please sort ASAP, or we'll be taking a grievance, A, for non-response, and B, for not having done it in the first place.
Thanks, Adam. Can I also suggest that if we are doing that, and I've put the regulations out there, and I'm just about to put the password now to the Dropbox. I'll do that in a second. I'm just going to put the password. I've got it all here. I just can't do two things at once.
Right. No, the password's there in what you sent. The Dropbox address is nuj.hands.resources@gmail.com.
Oh, it's on there. Okay.
And the password is headland_72.
Yeah, I'll put it on the.
Caroline, we actually have that. We've actually got that as a link. Stuart, which went in NUJ Active. Oh no, I went in Branch because Michelle wasn't very happy with us using a Dropbox she wasn't very happy with us doing it that way. So Stuart has kind of created a link. So I'll fish the link out at some point.
It would be great, Francis, if you could put the link on chat. That would be excellent. Thank you. The other important thing to remember here is around display screen equipment, which is about your setup at home, is it's not just about challenging an employer, but it's also about giving an employer recommendations. So this is what you want done. Don't just send it into an employer saying this is what is not right. Also send in saying this is what I need to make my setup safer and healthier for me. And that's really important. Make recommendations. Don't leave it to the employer to kind of decide what recommendations that they decide are good for you. David, did you want to come on in on this? Or another?
Excuse the change of location, but I've put the laptop a bit closer to the router, so I've changed rooms. So sorry if anyone felt a bit seasick as I went through the house. It was just the point about digital exclusion. There is the other flip side of that, which we found in the branch, is we've been having branch meetings by Zoom, and actually we've been picking up quite a few different members who don't normally attend, and part of why they don't attend is the distance they have to travel, and also that it perhaps falls on something inconvenient for them when they're doing something else and can't manage to get into the centre of Cardiff. So actually the technology has helped in getting to more members, and perhaps more importantly, because we've been having branch meetings via Zoom, although for years some of us have been banging on about how the way the branch meeting is organised is not conducive to getting members to come along and come back. We've now realised that on Zoom you can't spend 2 hours doing really bureaucratic stuff and expect to hold people's attention. It's actually made the meetings a bit livelier and more interesting for folks. So hopefully those who have joined us for the first time on Zoom will come back, you know. So yeah, I think the technology for us has actually opened up some possibilities, and we're loath when we go back to some sort of normal and we can turn up in person, we're still going to have that facility available to us. So for those people in South East Wales who can't get to Cardiff easily, they can still join in, you know, which still means we've got to think about how we make those meetings interesting as well, and not just do the same stuff time after time just because that's the way we've always done it.
Thank you, David. Really important point there about I'm gonna a final point on this, Anne, before we move on to the next bit, because we've got some other points I want to make, but I just want to pick up on one point that David made there about opportunities, because it is an opportunity for us as well. So we need to look at this in the whole thing, really, don't we? And it can be a huge opportunity.
Very quickly.
It can be a huge opportunity to...
Very quickly also, if I may, David.
Can I just stop you for a second, Adam?
Sorry, Caroline.
Can I stop you, because Anne did want to come in first. I just want to say it can be a huge opportunity, so it's about how we look at it. And I think the point that David made, as well as about how we can make meetings more interesting, is really important, particularly if we want to try and organise new members, try and encourage new members to get involved and to stay involved as well. Anne, did you want to make a point there as well?
Yeah, I'd like to back up what David said, that certainly Cambridge branch is far better attended now doing it by Zoom, but I'd also like to quickly make one caveat, which is that for some impairments, going to a blend of in-person and digital is going to be problematic, because if you're trying to focus on whether you're in the room or on the screen, the access to the other medium and the medium, if you're in the room, keeping all the sound going around you in the room and trying to keep your eye on the screen is quite hard. It uses a lot of cognitive processing for a whole range of impairments, but anybody who's deaf or deafened, it's particularly difficult. And then, and vice versa, if you're in there on screen and then people in the room are talking quietly, as tends to happen, because in person a lot of the most interesting things are the small asides that we exchange, the connections that we make. So there's going to have to be quite a lot of clarity about procedure to make it accessible for the blend. Thank you. Sorry, I'm sounding bossy here.
No, you're here to share your experiences, and it's really important that you do that, Anne, and this is the place to do it. So thank you, and again, we will follow up on these in terms of links and signposting. Adam, did you want to make a brief point on this?
Yeah, very quickly, picking up on David's point, in Leeds we were thinking about keeping branch committee meetings separate from full branch meetings, so that those of us who find ourselves involved with the union bureaucracy and dealing with all the business can do that separately. Other meetings are more topic or a discussion based, so that the business stuff is kept separate.
Thank you very much, Adam. Dan, would you like to come in?
Yeah, just to say, to add to what you were saying, we discovered the other day there is a way to make CCTV closed captions on Zoom.
Yes.
For deaf people, but I don't know, it's complicated.
I signed up to this very late, but it would have been much, you know, if I hadn't signed up to, you know, if I'd given Caroline decent notice, we would have tried to organise it for this session perhaps. But, you know, it is, I was on a Zoom last night, which did have the closed captions on Zoom. I think it may be something you have to buy as an add-on, and you may still need to pay the Palin typist, the speech-to-text translator, but I'm not sure of how it works technically.
I think it's to do with, I think it's to do with recording it. We discovered it completely by chance while we were doing a recording, and somewhere in there was an option just to type in your closed captions. I'd have to.
Thank you, Daniel.
Rerun that session.
Yeah, please,
or to rediscover it, but I can't remember where it was. But yeah,
I'd really like to know. Thank you.
And I will do some research on that as well. So for the next one, we make sure that we can include that. So I'll do that. Thanks very much, Dan and Anne. Okay, I'm going to move on now to, unless anybody else has got their hand up. No, I don't think so. I'm going to move on and ask Paul Seagate now, if you wouldn't mind giving your briefing, please, Paul.
Well, morning, everyone. I'm the National Broadcasting Organiser, so I look after broadcasting. I guess the clue is in the title. And I agree absolutely with everything that Nick said earlier. I think I'm probably quite lucky that I deal with a lot of big companies. So I deal with organisations like the BBC and ITN and ITV, who I do think in recent years have made great strides in trying to understand mental health better. Indeed, the BBC, for example, send their managers on something that's called a mental health awareness course, which is to help them understand mental health a lot better. And I know a lot of companies have mental health first aiders. I mean, I don't know if any of you have been on that course. I was lucky enough to go on it when I worked at the BBC, and it's really good. It teaches you a lot about mental health in general, to give you a better understanding of mental health in general, as well as giving you tips on how to us suffering or struggling with various mental health illnesses. So I think there have been great strides made, but having said all that, I still think that a lot of managers really struggle to understand mental health. I think, you know, if you've got a broken leg, or you've lost your voice, or you've got cancer, whatever, then clearly that they understand that, and they're sympathetic, and they know there's something genuinely wrong with you. I think a lot of mental health illnesses are not understood. Managers don't take it seriously. If you're suffering from depression or I think you're up against it from day one, to actually convince the manager that it's a genuine illness and they need to treat it seriously. And I also think that, you know, I've been involved in sort of helping people by the trade union for the last 15 years, and I would say in the last few years there's been a real increase in people suffering from mental health illnesses. Now, you know, I'm not a doctor, so I don't know what the reason for that is, but I think personally part of that is that the advance of just things like mobile phones, where you can't get away from work. You know, in the old days you'd leave work at 5 o'clock and then you wouldn't be contacted till 9 o'clock the next morning. Now you're constantly on, really, and even if your employers are not to blame, we're to blame, because often we'll check our emails just before we go to bed and there'll be something there that draws us in, so we're suddenly responding to that. So it just increases, I think, the stress that we're not having that break in between shifts. You know, we're almost working all the time. So I think that is a major problem, and I think, you know, as Nick said, it's people call us when they've got a problem. I've never had a member in 15 years call me and say, I just want you to know, Paul, I'm really happy. I love my job. My boss is great. And I think I'm paid the fair rate for the job. You know, I live for that phone call, but I'm not sure it's going to come. So every single phone call we get is a problem. And I think that raises issues about us looking after our own mental health, because when you're constantly dealing with people that have got issues and you're constantly listening to them, because that's what we do, I think it can have an impact on us. And you can think the world is a very dark place if all you're really dealing with is people with problems. So you can think every boss is bad, and you can get into the mindset that, you know, every employee is really bad because they're treating their staff really badly. And of course, actually, you know, we're only hearing from a small minority of the workforce who have the problem. So I think it's important that we understand looking after our own mental health. I'm not quite sure how we do that, but try and do that. And even if it's just, you know, I found during it, sometimes it all feels too much. I don't know what I'm doing. I can't make a decision. I don't know right from wrong. And I take the dog for a walk, and half an hour later, everything becomes quite clear. And I think, why was that? There's an obvious answer to that problem. Why didn't I think of that? So it's just about taking breaks, I think, especially during lockdown, because as the things that people have already talked about already, you do feel very isolated, and that is the thing I'm hearing back from members. They're not hearing from their boss at all, which for some people that's 3 months without hearing from their boss. But actually, for the vast majority of people, like, they want that. They want to know that they're still appreciated, that they're still part of the team, even though they're. So I absolutely agree with what everyone said about just reaching out and just saying hi. How are you doing? And I'm also hearing from people who absolutely love lockdown in the beginning. They like working from home. They like not hearing from people. But suddenly now, 3 months in, as they continue to work from home, they're beginning to hit a bit of a mental wall, and they're suddenly not feeling so happy, and they're beginning to feel a bit depressed, or whatever word you want to use. Often they don't know what the word is. They're just not feeling quite right in themselves 3 months into this program. And although lockdown is beginning to end, home working, I think, is going to continue, certainly for the rest of this year, and for some people forevermore. We've seen that, you know, employers are now thinking, actually, home working's worked, so let's try and make that the norm. So I think for a lot of people, that is going to be the norm now going forward, working from home. And I think businesses need to come up with a way of actually a policy on how they're going to interact with staff. There's no point just saying, right, here's your laptop, here's your monitor, go away and do your job. I think we almost need to start writing the policies on how good practice policies on home working, and how there needs to be interaction between staff and employers and managers. So I think that's something that we need to do, really. So I just think, yeah, companies need to adapt, I think, as we go forward, because home working is going to become the normal. But I suppose really just I think when people come to us with a mental health illness, often they don't know they've got a mental health illness, and we know that there's something not quite right. So I've dealt with members who you wouldn't think that they had any kind of mental health illness at all, and suddenly something happens. So it might be they find themselves on a disciplinary that they think is unfair, or they haven't got a job that they think they should have got, or they haven't got a pay rise that they think they should have got, and then it starts to eat away at them. And then you see them, you see them change before your eyes over a period of weeks and months, where they just can't. It becomes all self-consuming, and then they phone you all the time. They phone you once a day, twice a day, 3 times a day sometimes, and you become their only their main source of help. And I think that becomes quite draining, and how to deal with that. And I think that's when you need to realise that there's other help out there, and and to sort of refer them to their doctor maybe, or to EAP services, because we are, as Nick said at the very beginning, we are not mental health experts. We're not doctors. We are trade unionists. And sometimes I think our members think we have all the answers for everything, and we don't. And I think it's important to know at times to say, look, I don't know the answer to that, and refer them to somewhere else, to a specialist who may have the answers. That's it from me.
Thank you, Paul. I mean, that's added a huge amount to what's already been said, and also reinforced some of the things that people have been saying as well. I just want to pick up on a couple. First of all, Anne mentioned this earlier, which is about looking after your own mental health and well-being. if you're all doing an enormous amount of work in supporting everybody else, you can't do that unless you look after yourself. And I did a very early on in the lockdown, I did a webinar on looking after your mental health and well-being. And I'm not saying it's the best in the world, because I'm not a broadcaster and it was one of the first ones I did, but I think the information that there hopefully is useful for people, and there will be something that people can take away from it. I think it's really important that you put strategies into place to support you and help you when you're giving out so much to other people. And I think the point that Paul made about, you know, taking the dog for a walk, it's important we have a routine every day, whatever that routine might be, where we build ourselves into it. So we build into that, what are our needs to ensure our health and well-being? What do we need to do to make sure? And it could be yoga, it could be walking, whatever it might be, it's important we do that. I'll come to you in a second, Paul. And the other thing is, lockdown is ending for some, but not for all. Lots of people are still shielding, and lockdown is not going to change anytime soon for people that are shielding. The risks are still there. So that's going to be a huge problem for our members, who may well be shielding, who are being asked to go back to work, who are feeling particularly anxious because they're shielded and don't feel confident about going back into a workplace, or going back to do a shift if they're a freelancer, or going back somewhere where they don't feel confident about getting there, never mind about when they get there and doing the shift. The other thing is union networks. Paul mentioned about, you know, getting people to help each other. It's really important to develop those networks for people, so people can help each other and support each other. And we know there are lots of examples, really good examples, where union networks have actually provided that support and helped people to be able to signpost other people. Anne has made a point here. We are going to see an increase in unfair dismissals. We're also going to see an increase in redundancies, I think. And I think that's going to have a severe impact on people's ill health and distress over the coming weeks and months. Somebody wanted to come in here. I've got David with a hand up, but Paul put his hand up first. Paul, would you like to come in first?
Thanks, Caroline. Just wanted to comment on a couple of things that you said and Paul said before. I'm a rep dealing with members often facing disciplinary problems or dismissal or various workplace issues, and I haven't got the length of experience that Paul has, but not in terms of years. But I do. It does really strike me that the number of people that we see that are driven, are made ill by what they're going through, is really significant. And very often they feel that it's all them. They feel that their reactions are not normal. And one thing I find myself doing a lot is telling them that, you know, I'm no mental health expert, and I always guide them to seek help if they need it. But I tell them what they're going through, what they're experiencing is normal, given that the pressures they're under. And we all know, we see people under, you know, really intense and very unfair pressure. Sometimes that's pressure of work. I'm dealing with someone in broadcasting at the moment who's got a really high level job, and she's on call she feels like she's got to be on call from 6 a.m. to p.m. And that, you know, and if and that's without the pressure she's got of a boss who's persecuting her. So she's almost being driven mad in, you know, that's not a mental health term, I know, but in popular speak, she's almost being driven mad by the pressure. So I always tell people that it's normal to feel the distress that they're feeling, and it comes out in different ways. Very often they're mental health symptoms. It's extreme anxiety and feeling that they can't cope. Sometimes it's physical symptoms. People get stuff like IBS and so on, and they have to deal with that. But whatever it is, if I can see they're under really abnormal pressure, I try to reinforce that, you know, that it is normal for them to feel like this, and they need to not to blame themselves and to find ways of getting help and getting out of it. And obviously we can provide the help that's to do with the workplace, and we have to guide them to other places. And it's something, what I find difficult is, of course, not being an expert, you know, a doctor or mental health professional, you don't always know what is best and where they can get help. And some years ago, I had a chap who was in a terrible mental state and was actually on the verge of being suicidal. And of course, I was constantly asking him, you know, what help he could get from his GP and from the mental health services. But as we all know, they're all incredibly overstretched, and even the crisis team at the mental health service wasn't really able to help him. Luckily, and I wish I'd thought of this, luckily the guy's lifeline that he found was the local group of Mind, the mental health charity. And he found a fantastic counsellor who, you know, may well have saved his life. It was just astonishing. So it's difficult, and now I think a bit harder about how to look around for the help that people might need. And I just finally just reinforce the point that Paul made. It can feel a bit much for us sometimes, but as you said, Caroline, having a routine is a great thing, and I find the best thing is to go out with the dog.
Thank you very much, Paul. I think we all need to get dogs. So that's clearly a really good strategy, because it forces you out. You can't stay at home when you've got a dog who's nagging you to take them out. So thank you, and I'll come back to those points, some of those points in a second, Paul, particularly around acknowledging stress. I think that's really important. It's a starting point for everyone to acknowledge that it's normal. It comes in waves. So we know stress and anxiety very rarely is there with us permanently in the same way all the time. Actually, it comes and goes. Sometimes it's worse than other times. It floats around, all these kinds of things. But a starting point is to acknowledge it, isn't it? And once we've acknowledged it, we can actually try and then do something about it. Thank you, Paul. David, did you want to come in here?
Yeah, I've got a cat, and trying to take the cat for a walk is really stressful. It was kind of on a home working thing, because lots of employers have been very resistant to home working, partly for trust reasons. And actually what we found during coronavirus is actually it works really well. So I mean, I think we're not going to go back to that pre-coronavirus position of most people working in an office. I think quite a considerable number of our members will continue to work from home, not least because people are finding actually it's quite a relief from not having to commute and all of those sorts of things. And I know the Welsh Government is particularly wedded to the idea that their new normal is going to be that a lot of staff will work from home because of their commitment to the environment. They've seen that actually having lots of staff turning up at the same time every day in cars and whatever is not great. So we're going to have to get used to that. Now, when I was a dual PCS member, we had a house agreement with the Independent Police Complaints Commission on home working, and it covered, just about everything we've been discussing here. So through the TUC, I'm sure we're not going to have to reinvent the wheel on getting good guideline agreements to have with employers. That it's kind of been there and done that with other unions who have worked on these things. I think that's going to be helpful for us in terms of negotiations. However, I think what we're going to have to really think about is how we organise, because how we organise members who work from home is going to be an awful lot different to how you do it when you're in the workplace. Advice to reps is usually have a wander around, chat to people, say hello. When you see a new face, be welcoming, ask them to join the union. Well, if someone's working from home, that's going to be a difficult thing to achieve, and we're going to have to think a little bit harder about how we manage that, how we manage bringing people together as members.
Thank you very much, David. Yeah, some really important points there, particularly about how we organise going through and out of COVID-19. How do we reach out to members when we're not in a workplace? And I think we've got to be innovative and creative, and maybe we'll have a session around this at some point, because I think it would be really useful to hear some of the strategies that people are using, because I'm sure there are lots of different strategies, innovative, creative ideas coming out here that reps are doing already to reach out to people. Frances, did you want to come in on this point?
No, it's not really on this point. So if you want to continue on that, it's another point. So I'll come back later.
That's fine, Frances. I think I kind of wrapped up on that point. So please do go ahead.
It's more about kind of what you were saying about. It's more about what you're about using union networks, and actually it does kind of fit into what about networking and communicating with people. I'm hoping to do something on this in the next NEJ branch, which is going to be end of the next month. And I just wondering if we think of ways about improving communications and how the branch can help, how branches can help. Are there certain things that branches can put on? would it, not just something, a session about, mental distress or health, even if it's just putting on more social things, or making everybody think about how we can communicate better with members, but also with new people coming into work and whatever. I just wonder whether that's something that if anybody's got some good ideas on that, then I'll certainly include it in the work that I'll be doing on that.
Frances, before you disappear, would you just like to say what you're responsible for within the NUJ so everybody knows that?
Sorry, I also want to apologise for my lateness. I had some internet problems this morning, so I just creeped in, hoping that nobody would notice my lateness. Yes, I'm Frances Rafferty. I work in the comms and communications department based in London. Also responsible for a lot of our political work, and we're putting out every month NUJ branch, which is just kind of reflecting the sort of work that various branches are doing and our various campaigns.
That's great. Thank you very much, Frances. I'm glad you were able to sort your internet problems out this morning and join us. That's great. Okay, I'm going to move on now. Again, we can carry on having this discussion because I'm sure it will continue through after hearing from John Toner. John, would you like to come in now?
Thanks, Caroline. I'm going to have to be brief and then go because I've got another call I need to make. So I'm at the opposite end of the scale from Nick. I've been doing this a long time. I was mentored by Tom Paine in between the American Revolution and the French Revolution, and he found time to give me some good advice. And the good advice is your first duty as a trade union official is to protect the member from himself or herself. And the thing I've learned on my own is that when I've been doing this work for a couple of years, I thought, well, that's it. On a number of occasions, I thought, that's it. I've seen everything now. I've heard everything now. But it's not true. You've never seen everything. You've never heard everything. There's always something new. And when I came into this job, the job I'm just now 2.5 years ago, I took up a long-running case from my predecessor. It'd been running for 18 months. It ran for another 18 months. And the member was being taken through a procedure called some other substantial reason. There is a clause in the employment law which allows an employer to dismiss for some other substantial reason. Not something I had encountered before. And I felt that the member had a condition, I don't know what. And although I didn't discuss it with the employer, I thought the employer felt the same. She was offered the opportunity to talk to HR. I refused. She was offered the opportunity to allow the employer to see her medical records, and she refused. And in the end, she was dismissed because whatever it was she was protecting in her medical history was more important to her than the job. And I'll never quite go over that one because it was so tough and was demanding of me. But I give you that as an example of how difficult it can be to get a member to talk. And even professionals find it difficult. So that if you are interested in mental health issues, and you clearly are because you're on this call, then training, I would say, is an absolute priority. And more employers are coming to understand that having mental health first aiders in their workforce is hugely advantageous. And there are now many training courses in mental health first aid. What you need to check them out, they're not all good, but training should focus on identifying, understanding, and helping. But always remember, it is first aid. You are not a medical professional. There will be things that you cannot actually help with because it will require professional help, but you can help your colleague by showing him or her where to get help. And at the same time, if this is something that you want to take on, it's important to always remember that it's the employer's responsibility and not yours. And having said that, the employer should have a policy on mental health as part of its health and safety policy. And if they don't, then one should be developed, if possible, with chapel involvement. And while you might have to deal with an individual who has mental health issues and who needs support, the causes might not be unique to that person. And this cuts across what Anne was saying earlier. Although it may be only one person who's come to you, the causes of that person's issues could be causes that are common to the rest of the workforce. And if there are, then the causes should be addressed as a collective issue. It could be workloads, it could be long hours, it could be lack of breaks, it could be bullying. Increasingly, it could be social media abuse. And those are all issues for which the employer should be responsible and which can be taken up collectively. And when there is such an issue, it should lead to a risk assessment. And risk assessments are just as applicable to mental health issues as to any other health issues in the workplace. Which takes me back to the initial point. The most difficult part of this will always be getting the colleague who approaches you to talk about his or her problems. And no matter how good you are at listening, training is absolutely necessary if you want to be able to help someone. And that's really all. I feel like I'm the last runner on a relay leg, trying not to drop the baton before I cross the line. So I hope I haven't dropped it.
John, that was excellent. Again, really comprehensive. Thank you so much for that. Because again, you've added another dimension to that, I think, which is really important. And that's not just about the fact that it's an employer's responsibility, but this is a health, safety and welfare issue, which means it's a legal responsibility for an employer under the 1974 Health and Safety at Work Act 1974. That an employer has a duty of care, and mental health, mental distress comes under that. And I think that's a really important point to make. Particularly around the bit that talks about welfare, and which is where risk assessments come in. And risk assessments should include areas of mental health and mental distress. This is not just about looking at slips, trips and falls. It's about talking to workers about how they feel about the work that they're doing, talking about any stress and anxiety that is associated with the work that they are doing, the setup, the system of work that's in place, all these kinds of things. And of course, the really important point there again is that most of these issues that we're talking about here are collective issues and therefore should be addressed collectively through our chapel structures. Much more difficult through branches when you've got individual members. And I know of examples where you've got members who don't have chapels, for example, they're in unrecognised workplaces. There may be one or two NUJ members, and therefore it's a little bit more difficult to raise these kinds of issues. But being able to raise them through a health and safety and welfare route is much more powerful than any other route, because of course workers have rights in an unrecognised workplace as well as a recognised workplace around health, safety and welfare. So reps have rights to raise issues even if you haven't got recognition. And that's really important. And in fact, we've got a health and safety branch training workshop next month, which I will send you details of. So for any of you that are involved in branches and want to know about all the health and safety and welfare issues that you can kind of make reference to and use to help deal with some of the issues that you've got, then please do think about coming on that. I will send you the link at the end of that, the date for the end of that, and please pass it on to other branch members, because I have had trouble recruiting for it. And it's a really difficult area for those of you that are organising in branches to address. It's hugely difficult because you haven't got employers as such. You might have, you're going to have members working in a variety of different ways, either for themselves, casual, semi-freelance, all these kinds of things. So we've come to the end of listening to the officials, and thank you to the officials for coming and being involved in this, because I know it's been really difficult to kind of pin officials down at the moment because they've got so much going on at the moment. So I appreciate you being able to come along to this. Would anybody else like to raise a question, make a comment, share an experience? Anything else that you'd like to say? Paul, would you like to? Paul Breeden.
Thanks, Caroline. Two things. Yeah, one, it's great to hear that you're going to do health and safety session for branches. I think it'd be really useful. It's just to say, it's something that I often push whenever I'm talking to members, particularly members who are organising, you know, for the first time, setting up some people are setting up a new chapel, and always push it as something that they can make concrete steps, take concrete steps quite early on, because there are, as we know, there are more legal rights there than almost any other area that we deal with. But it's, even so, it's really difficult because people don't realise that. They're often focused on other things, and I'm constantly surprised by how frequently people don't pick up on this. And then even when, with the chapel I'm talking about, I've mentioned it several times and encouraged them to, you know, it's almost the first thing they do to appoint a health and safety rep, and I get assured that no, it's not a problem. And then I find out that one of the people reps I'm talking to, he's working from home, and he's the only place to put his computers on the dining room table, and it's giving him a crick in the neck. And well, that's the health and safety problem. So anyway, it's often hidden, but I do find I'm often surprised that people don't recognise the opportunities they've got there, and especially when they're not experienced in any sort of formal organisation, they're very reluctant to pick up on this. So it's something we've really got to just keep encouraging them to do, I suppose. The other thing I wanted to bring up, which is a completely different strategy, and is something we're doing something about as a branch in Bristol, threats and violence. This is something we've talked about quite a lot in Bristol branch, mainly because we've been appalled at what is happening in other parts of the country. Our members have reacted strongly at what's happened in Northern Ireland, and then recently at the threats that were made to our colleague Amy Fenton at the Mail in Barrow, who's been forced to leave her home. And then, having said we don't have problems in Bristol, we had a march a couple of weeks ago that was billed, I think, as anti-Black Lives Matter or something. Anyway, a right-wing march. The participants insisted they weren't right-wing, or they weren't far right. Did a very good impression because they were violent, offensive and racist. But what was really disturbing was that a number of journalists were attacked, not as violently as colleagues have been in London. It sounds as if in London, quite serious violence has now got quite routine around Parliament Square. It wasn't as bad as that, but I've spoken to members, one who was pushed over, and not at random. Someone snuck up on him and literally pushed his feet from under him, pushed him over while he was trying to film someone. And that was instructive because that was a young journalist. He's actually a student journalist. He wasn't a member. He's going to join up, but he was just someone young and keen, and he didn't realise the risks he was running. So he's had a learning curve. An Asian journalist, female Asian journalist, was given really nasty abuse, personal and racist, and I think pushed around. People were spat at. And called, all the nasty words you can think of. A freelance photographer colleague had full cans of beer thrown at him, which did no worse than splash his camera. But he said if one of these cans had hit his head, which is what they were aiming at, it could have been quite nasty. So these are real issues, and they're coming. This isn't unknown in Bristol. I mean, in Bristol, I think the problem is limited talking to colleagues who cover these sorts of things, it's pretty well limited to the nastiest end of the football crowd. And when we get far right demonstrations, which is not very often, and the numbers aren't huge, but it's a real problem. And clearly, I'm bringing it up now because I think it is on the increase, and we can expect more. And as a branch, we began talking about ways that we can keep each other safe and look after ourselves. And there's an excellent checklist of recommendations on the NUJ website. If anyone, I won't go on to I think the risks are obvious, but we're actually holding a Bristol branch meeting, and on Monday, you're welcome to join us if you'd like. I'm going to ask, Francis is still on, I was going to ask Sarah Kavanagh if she'd include it on her email tomorrow. But we actually got Amy Fenton from Barrow joining us to tell us about her experiences. She's the one, if you don't remember, who, again, far right involvement is suspected, but she's had to leave her home with her 5-year-old daughter because the threats were so severe. And she's been threatened many times over the years. And police only took action last year when someone actually threatened online to rape her, and the person who did that has been dealt with. Anyway, it's clearly something that's getting worse, and we don't need to exaggerate the fears, but we need to be aware of them, aware of the threats, and deal with them. So if anyone wants to join us Zoom meeting from Bristol on Monday, they'll be very welcome.
Or you need to send it to me. I do the list.
Sorry, Francis, I'll send it to you.
Okay.
Thank you. So Sarah's coming. That's why I said that.
Well, have you seen the story about Amy in the Herald front page today?
Not today. No. I've seen there are others. I'll have a look for that.
Have a look at Herald front page.
Thank you.
Okay, so thanks very much for that, Paul. Two things there, really. How do you support people having to deal with these things? But the other thing that you talked about, Paul, that was really important is members not knowing their rights and not knowing what they can do individually to help prevent some of these long-term health issues that they've got. And I think that's an issue for us as well. How do we help members to become aware of what their rights are, which is why we're running this branch training. I've put the date on the chat for any of you who want to come along to that. It is specifically to address that issue, Paul, which is how do you help people to know what they can do to help themselves. And as you say, 1/3 of the membership are freelancers, and therefore we need to help them to understand what they can do, because once you have upper limb disorders, once you have what's being termed now as tech neck, you know, this your neck which is locking, and your shoulders which are locking, all these kinds of things, once you develop these, it's very difficult to get rid of them and continue working. That's the problem for many freelancers. You know, that we've got to work because we've got to make money, but how do we do that when we're suffering from some of these conditions, very physical conditions as well? So thank you very much for that, Paul. Adam came first, and then Anne, I think.
Yes, pick up the public orders that were on the website have been updated in collaboration between the Health and Safety Committee and the Photographers Council. Again, with the Dropbox link, if you go to the file that's labelled situations, you will see there guidance about public order, covering courts, terrorism threats, political pressure. So again, it's clear there, certainly in terms of what branches and chapels should be asking from employers in terms of risk assessments for those assignments, and also for freelancers being aware of what they need to be thinking about if they're going to be putting themselves into or covering events where public order may not be an issue at the start but then develops. So again, those are all there. You've got the Dropbox link. You can go and have a look at them.
Great, thank you very much, Adam. Anne, would you like to make a point? You need to unmute yourself.
Adam's given the important link there, but I was at the Photographers Council this week. There was a lot of discussion about freelancers trying to buddy up. So if you are, so that was photojournalists and photographers, but and and discussion about how we can, I think there may be some further advice coming out, probably working in association with Adam on that. But it is self-protection. You need to be here to report tomorrow, sort of thing, you know. So I know getting the shot sometimes will push people to extraordinary lengths, but it's much better that they're there to get another shot the next day. And I think we need to try and hold on to that. Going back to members in distress, one of the reasons I first became active was support, and at first unhelpful support, and then very helpful support from this very union. So, and one of the things that I do remember strongly is that in retrospect, if I had understood the importance of being there tomorrow, rather than trying to win a battle with an employer that was going to dismiss you anyway, fairly or unfairly, I might have taken different courses of action. The union helped, I'm gagged, you know, non-disclosure order, but particularly like to cite Fiona Swarbrigg and John Frey as actually saving my life at the time, I think. But initially, the colleague, the rep that supported me, had difficulty themselves in accepting that mental distress was a very real thing. So there was an initial set of grievance where it was sort of Anne's difficulties, putting the problem back on the individual. Now, the individual at the time, being unwell, is unlikely to be as articulate and clear, and you might be obsessing on some small detail because it's the time that the boss bullied you, or the line manager, or, you know, and you can't see the generality, whereas reps, we see cases, similar procedures happening again and again and again, and I don't know, I haven't got the solution to it, but if there's a way of showing the member in distress different scenarios so that they need to actively choose their way forward, trying to encourage the member in distress to take ownership, because there is no doubt that fighting a grievance, fighting a tribunal is a war. It's going to give mental distress to people who are not distressed when they start out. So I think sometimes it's very hard, because the union does really well in representing members, but I think we have to bear in mind that the members' ability to wake up the next day alive, and the next day and the next day and the next day, is actually so important. And, you know, suicide rates between men are even higher because the higher self-stigmatization we still have and society still places. And I think it's often the quieter member who can't reach out that we need to be, I'm conflating a lot of different things here, apologies, but it's also the quieter member who may not be displaying their mental distress, but going through a grievance process, we also need to look out for, or the person who appears always strong, because they're likely actually possibly more vulnerable, because we're not aware that they're ill. Over and out. Can go on for.
I think you've made some really important points there, Anne, and it's something we talk about on the reps training. So we have significant conversations on the reps training, which is about helping members to find the answer for themselves. You know, the role of a rep is that, isn't it? I mean, the role of a rep is to listen to what members are saying, to try and read between the lines and try and find out what may be the underlying reason, to give that time to surface. So there are a number of techniques and strategies that you can use to help that, and then to help the member to decide what's the best route for them, while explaining the different routes so that they understand the significance of going down one or other route. And I think that's a really important point that we need to just kind of remind ourselves of, that in order for members to be able to take things forward and for us to support them in the most effective way, this is member driven. Members have got to decide what's right for them, because whether we think a particular route is right for a member, it might not be, because of the situation that they're in. And they might actually say, well, actually, all I want is the money, I want to walk away, because actually I want to work another day, I want to wake up tomorrow, and I want to feel better in the future, and I'm not going to if I go down that route. So sometimes, you know, it might be that we advise them one way, or we give them some advice and some options, and they choose to go a route that we think, well, perhaps they could do better down another route. But again, you know, it's really important, Anne, it's up to the member to decide what route they want to go down. And that's our role as a rep, is to give them the options, is to say, these are the options that you've got, what route do you want to take? And these are the consequences, these are the strengths and the weaknesses, etc. So, you know, and that's a huge challenge for reps, because you've got so much going on. You know, all of us are dealing with stuff for ourselves, but we're also then supporting members who are also in distress, they need time, they need patience, and, you know, it's not something that can easily be sorted out. So thank you very much for that, Anne. I think some really important points there. Anybody who'd like to share something, who hasn't perhaps spoken yet? I mean, there are a few of us left. We're a small group now, so because lots of people have had to go back and do stuff. Anybody like to share anything before we wrap up? Because we're almost at the end now. Okay, well, thank you very much for participating.